Welcome back. If you struggle with burning pain or tingling in your feet, Front Range Medical Center's chiropractor Dr. Dean Anderson shares how to free yourself from peripheral neuropathy. Glad to have you.
Yeah, glad to be here,
Let's talk
Gina.
about what peripheral neuropathy is in case some of the people don't understand.
Well, it's damage to our peripheral nerves. So most commonly it affects lower extremities. It'll start off in the ball of the foot or toes. It's kind of burning, altered sensation like something's in your shoe and it's not, and eventually it can become painful. Sharp shooting electrical pain. It can work its way up the extremities towards the knees. It can also affect upper extremities as well.
So then what really causes this?
Well, there's a number of causes, and most patients associate it with like diabetes or blood sugar issues, but neuropathy can also be side effects of certain medications. Chemotherapies can cause it, statin medications can cause it. It can be secondary to an underlying autoimmune patient or autoimmune condition patients have. It can be because of liver issues, kidney issues. So really that's one of the keys in successfully treating patients is making sure we know why they have it.
So you talked about the symptoms of it really, but what are patients usually dealing with if they have this?
Man, Gina, a lot of frustration and oftentimes because of pain that they're dealing with. Patients have a hard time sleeping at night. It's hard for them to be on their feet, so enjoying activities like hiking, going on walks is difficult. It affects their balance a lot. A lot of times patients have numbness and they can't feel things, so their balance, driving becomes an issue because they can't feel the gas or the brake. So a lot of frustration, a lot of hopelessness because they don't know what to do. They've oftentimes been told, nothing can be done for them.
This can really affect someone's quality of life then, I would imagine, if you're talking about, driving and that kind of thing, maybe even long-term complications?
Yeah, I mean, long-term complications are just, usually it's progressive. So as it progressive, those things we were discussing will just become more evident, and mobility will be limited more, balance will be affected more, and just a lot of frustration.
Talk about your approach then, because this is something, as you said, people deal with, don't know what to do, don't know how to get rid of it or cure it, but yet you're seeing really good results.
Yeah, a lot of success. I think the first thing to understand is when patients are diagnosed with neuropathy, usually they're put on a medication if they have pain, which can help. It takes care of some of the pain they have, but it's not doing anything for the nerve damage. What we do in our office is we do a very advanced form of electromedicine. It's called electronic signaling treatment. Nerves are electrical. This incorporates really high frequencies and amplitudes of current, and we're fixing or improving the functionality of those nerves. So we're able to decrease nerve pain, the burning, sharp shooting electrical pain. So with this advancement in treatment, we're really working with that issue, which is the actual nerve damage itself.
So you're actually seeing results then that maybe a lot of people aren't getting, because you're really getting to the root of the cause.
Yeah, absolutely. So the treatment technology is addressing the nerve damage patients are dealing with, the pain they're dealing with, and then in addition to that, we spend a lot of time in making sure we know why patients have it. Again, whether it's blood sugar problems, it's autoimmune issues, it's side effects of medications, and we address those underlying issues as well. So then when this treatment technology gets them better and they get their lives back, it won't come back. And that comprehensive approach is what allows for success.
Success is what we want. 303-586-7897. Just go ahead. If any of what Dr. Dean is talking about resonates or sounds like something you or a loved one may be dealing with, call that number right there. Now, you do have lots of happy patients, some who have seen just life-changing results. Let's listen to one.
When I first started coming to Dr. Anderson, I had no feeling in my feet. It was very, very difficult for me to drive a car because I couldn't feel the brake pedal anymore. What has happened since is absolutely fantastic. I no longer fear losing my balance as I walk. I have feeling in my feet and lower legs again, and driving a car makes me much safer on the roads than I used to be.
He sounds so happy because you can tell the little things that he wanted to do with his life, he can now do again. So talk about the fact that, are those typical results that you're seeing in your office?
Yes, typically. And a lot of times when patients come in, there's kind of two classifications. Patients with pain, and when they have this nerve pain and we reduce that, then they can sleep at night, they can enjoy walks, and just be on their feet longer, reduce medications. And then we have patients who have numbness, paresthesia, balance issues. So those patients are able to get feeling back, so there are no longer fall risks, they feel more comfortable driving. So these are typical results. This is what we want to be able to see after a few weeks of treatment.
Well, tell our viewers at home really what makes your office unique.
Yeah, well, Gina, it's really, number one, the treatment technology we use. It's a very advanced form of electromedicine. It's all about addressing the underlying issues of those nerve symptoms patients have and nerve damage. But In addition, we spend a lot of time looking at diagnostics, combing through past history, and we want to make sure we understand why patients have it. And we address those underlying issues. So when we get those nerves better and patients are more functional, it won't come back. And that's what allows for long-term success.
Boy, when you talk about, people suffering from pain, any sort of life-altering situations like that, I can only imagine what you do must be extremely fulfilling.
Yeah, absolutely. I mean, when just simple things, I'll have patients who will say, man, I walked across the carpet barefoot and I could actually feel the carpet.
Oh, yeah.
And those things for patients they're little things that we don't think about, but oftentimes it's just a huge deal for those individuals.
All right, receive a $27 consultation. Now that's normally $245. Call 303-586-7897. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. Visit denverneuropathy.com. Dr. Dean Anderson paid for today's appearance.